Hello, and welcome to Living a Graceful Life. I'm your host, Denise Medved, and I'm also the creator and founder of the Ageless Grace Brain Health Program, which is being taught in 50 states in the United States and also 30 other countries to help people with their function, their attention, their focus, and help their brains be sharper than ever, no matter what their age. So what we do on this show is remind you that it's never too late to begin making choices to create the life that you want to live. And we talk about what adds grace to your life. Well, certainly less stress, more beauty, more enjoyment, more nature, more close social interaction and relationships. And it's very important that we have a workplace environment that is as little stress as possible, and ideally is a wonderful and enjoyable place to be able to work. And so our guest tonight is going to help us have more grace in the workplace by talking about bullying. And so what we're talking about is bullying in the workplace, the what, who, why, and how. And we're talking about what makes an organization whole and what ways you can recognize bullying taking place, or perhaps it's happening to you personally. So I'm so happy to have you on our show tonight, Dr. Okoli.
Thank you. It's my pleasure and my honor.
So glad you're here. So let me tell you just a little bit about her, and then she can tell a little bit more about herself as she goes along and talks to us about bullying in the workplace. She describes herself as a doctor for your health administration needs. And that especially is as it pertains to healthcare. That's her area of expertise. She has a doctorate in health administration through A.T. Still University and has over 19 years of combined working experience in the healthcare industry at the front lines, academia, research, and administration. She's the owner of Shalom Eagle's Wings, a business that provides consultant, advocacy, and empowerment services. And we will tell you at the end of the show how to get in touch with her, how to follow through with her, how to sign her petition, and how to find her book. So she helps with any area of work in administration, including strategic management, governance, return on investment, risk management, quality improvement, workforce development, partnerships, change management, policies, conflict management. And she actually helps companies diagnose, makes recommendations, and treats any of your administration needs as a consultant. So I'm looking forward to having her tell us a little bit more about what is workplace bullying.
Well, thank you. Thank you for the introduction, Denise. And yes, workplace bullying. It's a very interesting topic, one that some people shy away from, but the reality is we need to talk about it. So what is workplace bullying? So basically, workplace bullying are actions, either physical or psychological, that are repetitive in nature. And the intent is to cause either harm or to belittle someone. And that's the key of this bullying. So the key is it's intentional and it's repetitive, and it can be physical or psychological in nature. And in terms of what it is as well, like depending on who is doing the observing, you may not readily detect it. So it's not so much just the intention, but it's also the character. So it's the character of the behaviors, the intention, the frequency, and the effect and impact it has on the individual who is the recipient of those behaviors. So that's what it is in a nutshell.
Right. Can you describe some examples of what might be workplace bullying?
Absolutely. So for example, so if we talk about some behaviors to demean somebody, so it could be a supervisor yelling at somebody. It could be take the form of sabotage, so being excluded from meetings, workplace meetings. So there could be a meeting organized for the team, for instance, the particular individual is excluded from it. So that's a form of kind of like exclusion. It could be sabotage in terms of maybe the individual is supposed to present and no one tells them they've changed the Wi-Fi or they have a new technology, for instance. In terms of from a psychological perspective, it could be anything like gossip, defamation of character, assassination of character, because these things, behaviors, and again, the key is has to be repetitive, right? These behaviors create a negative label and impression of the recipient if gossip is involved, especially if it's not verified. I like to talk a little bit about a theory called attribution theory, which basically is a kind of perception theory. And it's all about you observe a behavior, you have to believe the intent of the behavior was such that to create a behavior, and then what were the environmental factors? Was it something internally that caused it or externally that caused it? So individuals, for instance, are gossiping about somebody. Their intent is either to make the person look bad, smear their names across the employees of an organization. And what is the effect of that? Or what are the effects? Either the person is isolated from other colleagues. When it comes for time for promotion, for instance, their supervisor or senior management has heard whispers of such inaccurate perceptions of the individuals. So that affects their ability to either be promoted or given work assignments. You know what I mean? So yeah, so those are some examples that come to mind readily.
Yes, all things that make me cringe, to hear how difficult it would be to get up in the mornings and go to your workplace when that's happening to you, whether it's one single person or whether it's a group of people. I'm making an assumption that a group of people could also be participating in bullying by the behavior of that group to exclude someone or to sabotage them or to create false rumors about them.
Absolutely. And when it becomes a group, the terminology that you might find seen in the research is called mobbing.
Ah, okay.
That's right. Yes. So which is even worse. I mean, it's like compounding the effect. It's one thing to deal with one individual who's the bully, let alone to have a group of individuals. And the sad thing is that the individual might not recognize what's happening. They might start having false perception that perhaps it's something they've done or something inherently wrong with them, which is inaccurate, right? So it takes a trained eye, I say, to recognize the acts of bullying, because sometimes it's covert or sometimes it's overt. So the behaviors I mentioned earlier, depending on the gravity and severity, might appear to be covert. But when you talk about mobbing, again, if this individual doesn't have any witnesses, it may be hard to prove.
Yeah, wow, that's tough. That's one of the reasons I really was interested in having you on Living a Graceful Life, because I think it's my perception anyway that a lot of people don't recognize when they are being bullied or when a colleague is being bullied. They'll sort of wave it off and say, "Oh, well, he said something mean," but people, that's what people do sometimes, and they don't really look at the extended and repetitive behavior, as you're mentioning, that makes it probably unbearable for the person who's suffering from it. And sadly, then the person who probably quits or leaves or takes a back seat when they could shine is the person who's being bullied, not the person who's doing the bullying, right?
That's right. Yeah, you're absolutely right. You mentioned something earlier. I don't know if you meant to mention it, but you said something about you get sick in your stomach. That is one of the signs. So if you, as an individual, feel like you dread going to work, waking up, or on your way to work, you're crying, that's not normal behavior. There's something happening. If you feel that dread in your heart, in your spirit, you're crying, or those are telltale signs. But this individual, number one, they may not recognize this again, but if they have a confidence that they can share with, okay, this is what's happening. I don't know why I feel this way every day. Hopefully that person can help them in asking certain questions. Okay, why do you feel this way? What's happening at work? To kind of unearth what's happening, right?
Yes.
Because sometimes when you're thinking of just by yourself, you're so involved you might not be as objective as an external party looking in. Now, again, depending on the work environment you find yourself, if it's psychologically safe, if individuals are all bullies, again, from a covert fashion, that poor individual that's being bullied, I'm sorry to say that it's not going to be very favorable for them.
Right.
I'd like to introduce something called, it's not my original, but by a group of authors by the name of Padilla and Co. They introduced something called the toxic triangle. Mm-hmm. Different versions, you might hear the toxic triad, the toxic leadership triangle. So basically what it is a triangle. At the top of the triangle is a toxic leader. At the bottom, you have the colluders or conformers. And on the right, you have a conducive environment for the bullying to take place. So you need all three of those factors for bullying to happen. So when we talk about those who are observant, I want you to talk a little bit about mobbing. So let's talk about a little bit about the mobbing part of things. So under the colluders and conformers. So colluders are people who join to participate in that act of bullying. Conformers do, but it's a little bit different between the two. Conformers are those who maybe they have low morals. They feel, okay, we just have to conform to what's happening. Colluders are those who, they have an agenda. Mm-hmm. They want to be seen in a positive light with the toxic leader at the top. So this toxic leader tends to be charismatic and be narcissistic and have their own negative agenda. So you can imagine when you have all three of those parties, a conducive environment, meaning an unsafe psychological environment, psychological safety environment, one that's unstable, then throwing a poor individual who either for one reason doesn't really fit in well or shines and people are threatened by that. So if those colluders and confirmers and the toxic leader have an agenda, they will see this individual that's shining as a threat. Then they start their sabotage and the exclusion, right? So I just thought I should throw that. So bullying doesn't discriminate, but there are some people who might be more at risk to being bullied. Bullying is never justified. I want to emphasize that. Never is it justified, but there are some people who are more susceptible, AKA, especially if they find themselves in that toxic leadership triangle or an unsafe psychological environment.
Right. And that was interesting that you said it could be someone who shines, someone who's doing really well and achieving, and everyone else is saying like, we don't like that, you know. So they're possibly colluding to bring that person down a notch, so to speak. I can see why that would be. What does someone do if this is happening to them, or if they see it happening to someone else in their workplace? Because that could be another thing, is that you might observe it happening to someone and that person may not even be aware what's happening, but you see it as a third party.
Yeah, excellent question. So before I answer that question, I want to state the statistics according to the government of Alberta in 2018. Specifically from the Canadian Safety Council, 1 in 6 people have been bullied and 1 in 5 have witnessed another being bullied. So what can you do? So I'm going to break it down. And yeah, it's quite a high statistics and an unfortunate statistics, actually. And this is 2018. So I can only imagine what's happened between then and now. That statistics must have risen, right? So what can one do? So so I kind of alluded to a first hint initially when I said, find a confidant. Second, if you become convinced that you're being bullied, number one, I highly recommend every employee needs to be cognizant and aware of their workplace policies. What does it have to say when it comes to bullying or respect in the workplace? Be aware of that, track it down, look at the different steps, because with most bullying policies, either for the organization or for the province or for the state you belong to, there are steps one needs to take. So if you observe it, so when let's say you as a person being bullied, retrieve the documents, read the policies. The next step is usually, most supervisors always say, have you spoken to the individual that's bullying you? Have you asked them to stop? If they haven't, then you climb the ladder, which would be go to your supervisor. Report verbally. Some organizations have internal reporting systems electronically that you complete as well. So again, you need to be cognizant of what's happening in your environment, in your organization, what's available. So report it verbally and document it. Some organizations have unions, some do not have unions. So if you have a union, I invite you to, or recommend you contact your union. Now, some parties, again, depending on how healthy your work environment is, do not feel comfortable going to the union, or there's, depending on the size of the organization, there's a third-party entity called like EFAP, Employee and Family Assistance Program, which is supposed to be confidential. Some individuals, employees, do not feel comfortable. They don't believe it's confidential. They believe it's going to get back to their employer, whoever it is, right? So, and then you can also take the path of external resources. So for instance, since I reside in Alberta, Canada, we have, for example, there's a distress line. So you can give them a ring. And I know particularly they have bullying. If you've been bullied, you can report to them. There are other organizations like the Red Cross, which has educational programs about bullying. So these are external parties, totally unrelated to your organization, you can do. But from an internal perspective, like I said, I'll reiterate, find your workplace policies on bullying. As individuals to stop. If they do not stop, that's climbing the hierarchy of going to your supervisor. If you feel your supervisor is not being very receptive, you can still go higher up in the chain. I know of somebody who resorted to trying to go up the chain. They were not expedient in their response. The individual ended up going straight up to the CEO. And then things started moving like whirlwind. Right. But it's very sad. It shouldn't have to get to that. You should never have to get to that. Yeah.
Wow.
Keep going on and on.
Well, there are a lot of external organizations I know that deal with bullying that might give the person advice, at least, yeah, or point them to counseling about what to do. Point them to someone like you who could help the organization with the bullying issue. And one of the things that we talked about before the show even began was, because Ageless Grace is mostly taught in senior areas, meaning mature adults. It is for anyone of any age, but it's most popular in retirement communities, independent living, skilled nursing care, assisted living, memory care, senior centers, hospital wellness centers that cater to over 55-year-old adults. I would love for you to talk about bullying of seniors, and those could be clients, residents, students, guests, family members, and they could be bullied by many people, especially I've noticed if they have any form of cognitive decline.
Sure, absolutely. I will talk about that, but just before I get to that, something very imperative to mention based on the last question you asked me, what to do: document.
Yes.
Place, time, frequency. Keep a log. That is vital, because people need the data. In healthcare, it's all about where's the data, where's the proof, any witnesses? Well, if there are no witnesses, at least you have that written trail, okay? Right. So I just want to mention that. So now going back to your question, yes, sadly, and it does break my heart, there is bullying amongst the senior populations in environment and facilities where there are vulnerable individuals. So you would like me to talk about the nature or what to do if one sees it? What exactly?
Let's talk about the nature, and then let's talk about what can be done. You see it or observe it.
Sure. Okay. So the nature of it, sadly, can take the form of, again, going by the definition of bullying, which is any repetitive, intentional act to harm either physically or psychological, okay, an individual. In those protected environments, let's call them long-term care or assisted living, supportive living, depending on your jurisdiction, it could be independent living, it could be in the home care setting where you have care professionals coming to the home. So bullying can take the form of physical in terms of hitting the person. It could take the form of different forms of abuse. And sadly, with the elder population, it could be financial abuse, it could be sexual abuse, it could be emotional abuse. So those are some examples of the nature. Now, when it comes to the individual who has some cognitive impairment, which is very sad because sometimes some people get confused when they start reporting that they're being bullied or being abused. People get confused. Is it a memory issue? Are they mistaken things? The classic example most of you might have heard is about when they say, oh, someone is stealing from me. Sometimes it's true that they are stealing from them, but sometimes they're mistaken in that they forgot where they place an item, right? So it takes, so an investigator coming in, and when I use the word investigator, I don't necessarily mean from the criminal system. It could be someone in administration, a consultant who is coming in to investigate these reports of abuse of any form. One thing I want to emphasize is this. Elder abuse is never tolerated. If you as a healthcare professional know or even suspect, you don't even have to have proof. In Alberta, for instance, you're mandated according to the Protection of People in Care Act, you must report it. So I invite you, no matter what jurisdiction, province, or state, or nation you belong to, find the equivalent of such an act. I know in the United States, for example, there's the National Institute for Aging. They have some resources, and one of them is about abuse locator. So contact them, you find phone numbers. So again, regardless of what setting you are, if you suspect elder abuse, you are obligated legally and ethically to report it. It's better to err on the side of error, as in, oh, I was wrong, versus missing an incident that could, even worst case scenario, take the life of the senior.
Right.
Yeah. Okay. So we've talked about the nature a bit. We've talked about some resources you can contact in terms of assistance. Yes. So sadly, some of the things I've witnessed, having worked as a director of care in a facility, and basically I'll describe what the facility was. It actually had about 4 programs under one roof, which is independent, assisted, supportive, and long-term care. I use the word long-term care because that's what we use in Canada. Some might say nursing homes, depending on the states. If you're in the United States, they might use nursing skills facilities and so forth. But that's the setting I'm talking about. But the same principle applies to areas where people are mentally challenged, disability, the same principles, okay? So find the act for your province or your state that's applicable. It gives you some guidelines how to deal with elder abuse. Worst case scenario, there's nothing wrong with calling that 911 if you're in North America, and whatever it is, depending on where you're watching globally.
Right.
Yeah.
Is the first step, if you're an employee in a long-term care facility of some type or another, and you notice the behavior of another employee that's abusive verbally, physically, financially, any of the ways that you mentioned, is the first step possibly to go to the director of the facility and say something about it? Because again, you mentioned that director might be a bit investigative and go and see, let me watch this and see if I see anything that you're talking about.
So yeah, so if you suspect, depending on your role in the facility as an employee, there's a hierarchy. So it might usually take the form of contacting your charge nurse, whoever the person in charge. And when I say the word in charge, because think about it. Okay, so let's spin. So you have the employee, you can have the charge nurse, and then you have the administrator. Okay, so you usually talk to the charge nurse or whoever the equivalent of the charge nurse is. Some may not have a charge nurse, they might have a general manager. Go through that hierarchy. Depending if you feel you're not getting a good resolution or not being heard, climb that ladder. But most importantly, one thing you cannot afford to do is document. Regardless of if you're being heard or not being heard, you must document every single thing. Now, if it's family, because again, sadly, it might be the family members doing the abusing. So one of the, again, document, but have a conversation. If you don't feel comfortable having that conversation one-on-one, invite again, either the charge nurse or the equivalent, and then do that climbing again. Because bullying, elder abuse is a very sensitive topic, and the fact you're legally required to report it, if you don't, some facilities might be fined. But again, it's not just about being fine. It's about the individual, the human being in front of you that's being bullied. They're worthy of respect and they're vulnerable. You're supposed to protect them. Okay. If that were your own family member, how would you advocate for them? How would you do everything in your power to stop the bullying, right? So some of these things I'm thankful and I'm happy we have policies to guide us, but it's just basic human interaction in the sense of how would you want to be treated? How would you want your loved one to be treated?
Absolutely. That's a beautiful guideline, needless to say, as opposed to saying, well, I just work here, I'm going to turn a blind eye. It's not my job. But it is, and it's the way you would want your family member to be treated. Absolutely. I'm mesmerized. I'm hanging on every word, and believe it or not, we're down to the last few minutes of the show from the content portion, and so I'd love to let everyone who's watching know how to reach you. How would they get in touch with you? How would they get your book? Some of the things I promised at the beginning. If you would like to share that with us, I know people would be interested.
Sure, thank you. Yeah, so you can reach me via email at cheryl@shalomeagleswings.care, care because I care for you. And my website is shalomeagleswings.care. Now,
and it's Cheryl with an S.
Cheryl with a C.
With a C, right.
Sorry, yeah, Cheryl with a C. Cheryl@shalomeagleswings.care or shalomeagleswings.care for my website. And yes, I do have a book. So it's not geared towards bullying, but it's all about conflict resolution. The setting, when I wrote the book, is all about the operating room, but the principles apply across settings of healthcare and industries. And you can find the book actually either on More Shops. More Shops is for my European audience and for Denise's European audience, if they will. And you can also find it on Amazon, either Canada or United States as well. So the book, I'm just trying to share my screen here to see if
yes,
you can see it.
I can see it.
Oh, perfect. So this is what the cover looks like. And yeah, so you can feel free to do that. And then I also have a petition. So what is this petition all about? So given we've known healthcare providers sadly have been burning out and overworked prior to the pandemic, and even more so now. So I started a petition basically to provide a retreat for healthcare providers who are working either at the front lines, administration, research, academia, a retreat whereby they can glean and learn conflict resolution skills, quality improvement tools to empower them to go back to their workplaces to be effective change agents, positive social change agents and work change agents, but most importantly, to rejuvenate them holistically, their physical, mind, spiritually, mentally, socially, right? There will be some counseling. However, I won't tell you all the details because that's for you to find out in due time. But what does it look like? I do have a little glimpse for you. And this petition, I'm just going to show you how you can access it. So if you were to type in my name do a Google search randomly and type in my name, you can see it available. And the petition itself talks a little bit more about the statistics of first of all, what bullying is, workplace bullying is, harassment, provides different statistics on that, and then burnout, of course. And then last but not least, it talks about my ask, as in, please sign and share. You don't have to belong to the healthcare provider, also healthcare industry to sign it or share it. If you believe healthcare providers need to be taken care of, sign it, please.
Absolutely. Well, I encourage everyone who's watching and listening to go and sign this petition. And again, just put in Dr. Cheryl Okoli and you'll be able to find her petition and be able to sign it and share it. Don't forget the sharing part. That's very important too. I would just also love to tell everyone about how to get in touch with Ageless Grace. It's agelessgrace.com, AGELESSGRACE.com. And it's all about helping your brain be sharper, be clearer, work better, fire more neurons, and generate new brain cells so that you can stimulate neuroplasticity. And it's very tied into everything that Dr. Okoli has been talking about tonight, because it's very much used in the workplace of long-term care, senior care, mature living. And so it's very tied in. We have thousands of educators all over the world who are working with an older adult population primarily. It's for anyone who has cognitive function. And as we know, that occurs in younger people as well, but it's specifically directed at older people. So I would love to thank everyone for being here. And I would like to remind you all what our purpose is in this show is to remind you that it's never too late to begin making choices in your life to create the life that you want to live. Thanks for being here, and we'll see you next week, 7 p.m. Eastern, 4 p.m. Pacific time on Living a Graceful Life.